everybody, I'm Dr. Stephen Cain. I help people with peripheral neuropathy get out of pain and back to doing the things that they love doing. One of the ways that I help is by providing you with this video educational series that gives you tips to help get you some much needed relief. This particular video is about the 5 most practical blood tests for most people with peripheral neuropathy. Now, this is not a completely exhaustive list of blood tests that can potentially help you out, nor is it enough in and of itself to delineate what exactly is causing your neuropathy. You most certainly need to get a full health history, a proper examination, and sometimes you may also need additional imaging or testing to be done as well. With this said, I picked these 5 tests because they are applicable to a rather high percentage of people that have peripheral neuropathy. So let's get into it. First test here is the hemoglobin A1C test. This checks for your average blood sugar for 3 months prior to when you take the test. The benefit to this is you know what your nerves are subject to on a day-in, day-out basis. The fasting blood sugar test, this is just one snapshot in time, whereas this A1C gives much more information as to the story behind what is going on with your nerves and the blood sugar levels that they are experiencing. Now, obviously, this is extremely important because diabetes or blood sugar issues is the leading cause of peripheral neuropathy in industrialized countries. Hence, this is a must-have. You need to know where your blood sugar levels are, and when it comes to the A1C, ideally, you want to have it at 5.5 or maybe even a little less. 5.7 to 6.5 is pre-diabetes, and over 6.5 is full-blown diabetes. So the higher the blood sugar, the more toxic it is to your nerves, so you want to have it lower, again, 5.5 or a little bit less. Now, a good thing about this A1C test is that this is something you can do at home. Most people don't know this, but you can actually get home test kits where you can check your A1C levels. I'll leave a link in the description as to where you can get these testing devices. The second test here is the oral glucose tolerance test. This is where you drink a solution that has 75 grams of sugar in it, and then 2 hours later, your blood sugar levels are checked to see where they're at. So what this does is check how effectively your body metabolizes sugar after you consume it, which is very important because if it spikes up and doesn't come down quick enough, then again, your nerves are going to be subject to a toxic amount of blood sugar after you eat certain foods that have certain types of carbohydrates in them. Where the A1C is only going to get the average for about 3 months, knowing how well you can manage your blood sugars after eating certain foods is extremely important as well. It's also very important because of the sensitivity that this test has. One test showed that in people that had idiopathic neuropathy, 1/3 of them had a positive oral glucose tolerance test where it was not picked up on by the A1C test. So again, very important to know your blood sugar situation, the average 3 months of the A1C, and how effectively you metabolize it after you eat it with the oral glucose tolerance test. Okay, third test here is the methylmalonic acid test. This checks for your B12 levels even better than the standard B12 blood test. Now, this is very important because B12 deficiency is the most common vitamin deficiency to cause a neuropathy, and there's lots of older individuals that have deficiency of B12. There's also lots of people that take metformin, a particular medication for diabetes, that also have a consequential deficiency in vitamin B12. So we've got a lot of people with peripheral neuropathy that are both in their older years and or taking metformin, therefore having the methylmalonic acid test to check for potential B12 deficiency is very, very important to do. Okay. All right, fourth test here is the vitamin D test. This is very important because vitamin D orchestrates your immune system, and autoimmune conditions are a very common cause of peripheral neuropathy. Furthermore, research has shown that people who are deficient in vitamin D that also have diabetes are much more likely to go on and develop a painful diabetic peripheral neuropathy. And on the flip side of that, people that have a painful diabetic neuropathy and are deficient in vitamin D, when they supplement with vitamin D, get the levels up, then the pain starts to go down. So most certainly check your vitamin D levels. This is a rather common deficiency that most people have. Fifth and final blood test that I'm recommending in this video is for gluten sensitivity. One study showed that in a group of people with idiopathic peripheral neuropathy, about 1/3 of them had gluten sensitivity. And so if someone has a gluten sensitivity and they're consuming gluten, this can trigger their own immune system to start attacking the nerves in their body, which can lead to a peripheral neuropathy. So find out if you are gluten sensitive, and if you are, then you most certainly need to avoid eating foods that have gluten moving forward. Okay, once again, these are just 5 highly relevant blood tests for most people with peripheral neuropathy. By no means a completely exhaustive list of blood tests, nor is it in and of itself enough to delineate the cause. You must get a full health history examination and possibly some additional testing or imaging to know for sure what's causing your neuropathy. All right, everyone, continue to stay relentless in figuring out what's causing your neuropathy, and then once you figure it out, attack it with everything you have in your power, and in time you will be feeling better, and I can't wait for that to happen for you. Thanks for watching, everyone. I'll see you in the next video. Take care.